Hello everyone, myself Barsha Roy and I am pursuing my Bachelor's of Physiotherapy degree from Marwari University, Rajkot. So in this video, we are going to discuss about the drug which is well known to everyone, and that is paracetamol. So in this video, the contents we are going to see: the basic introduction to the paracetamol, the mechanism of action, pharmacokinetics, uses, adverse effect, acute paracetamol poisoning, and the doses. So let's start with the introduction. So paracetamol, it is the diethyl active metabolite of phenacetin that was first introduced as a medicine in 1893. So what does it mean? The phenacetin, which undergoes by the process of diethylation to produce paracetamol in the liver, and this paracetamol is responsible for the antipyretic and anti-analgesic effect of the phenacetin. And now the mechanism of action. The central analgesic effect of the paracetamol is like aspirin, which increases the pain threshold, but the paracetamol is effectively acting as an antipyretic drug. So first, the paracetamol is administered by the patient. Oral route of administration you can provide, and then after administration, that paracetamol reaches the central nervous system or the brain after crossing first pass metabolism in the liver, and there it inhibits the prostaglandin and it shows the antipyretic effect by acting on the hypothalamic temperature centers, which ultimately increases the heat loss and decreases the body temperature and shows antipyretic effect or the fever reduction. Now, pharmacokinetics. So in pharmacokinetics, first one is absorption. This paracetamol is well absorbed by the oral route of administration, but in emergency condition, it can also given by the IV route of administration. And metabolism occurs mainly by conjugation with glycolic acid and sulfate. It means this paracetamol combines with the glycolic acid and sulfates, which make this paracetamol drug water soluble, so it can be excreted or removed from the body easily, and excretion is mainly rapidly occurs in the urine. So uses, as we already discussed, this paracetamol is more effectively working as an antipyretic. So how it works as an antipyretic, which we have already seen that how the antipyretic mechanism was there, like it acting on the hypothalamic temperature regulation center, and then it increases the heat loss and decreases the body temperature. And the second one is analgesics. This medicine helps to reduce the headache, musculoskeletal pain, dysmenorrhea, or any other kind of pain by increases the pain threshold level. And third one is osteoarthritis. By this, for the osteoarthritis, this medicine is first choice of drug for analgesic effect in osteoarthritis by many professions, and this medicine can be given for any kind of fever with any causes in children, because it do not have any risk of Ray's syndrome. Ray's syndrome is something which is rare but severe condition by in which the brain cells swells and the liver failure also occurs. Now the doses. In doses, 325 to 650 mg tab 3 to 4 times a day. For children, it is 10 to 15 mg of drug. And the most common tablets or the drug company is Dolo 650 tab or Paracin 500 mg tabs. Now, adverse effect. This medicine is well tolerated and safe for the patient if it is taken within the normal limit of the drug which is prescribed by the doctors. And the common side effect can be seen is headache, nausea, skin rashes, or stomach discomfort. But it is for if you discontinue the drug, it is okay. But if these symptoms persist, you should recommend a doctor again. Now, the acute paracetamol poisoning in children. This acute paracetamol poisoning, this is occurs due to overdose of the paracetamol by the patient, and this condition is more common in the children because the ability of the liver of the children is low to process this drug, so it can lead to hepatotoxicity and nephrotoxicity. So hepatotoxicity, after taking the large amount of the dose by the children, after 12 to 18 hours, this drug can leads to severe damage to the liver cells, and it leads to a condition called quadribular hepatic necrosis. If this condition persists, then it can lead to jaundice also, or if this condition got severe, then it can also lead to liver damage. And now the nephrotoxicity. This medicine can also damages the kidney, then by which the renal tubules got damaged, and the kidney function reduces, which leads to hypoglycemia. And if this hypoglycemia persists for many more like longer period of time, which can lead to coma also, or the higher level of drug in the blood can lead to liver failure. And this is my reference, The Essential of Medical Pharmacology by K.D. Tripathi. You can refer this book for the paracetamol or pharmacology medicines. Thank you.